Here we go for recording. All right. So moving along. Um, First of all, we'll start off with updates from child nutrition. So, Trisha.
Hi everyone. The update that I have is for the school breakfast challenge. We have a lot of schools participating, a lot of new schools that we haven't worked with this year, and several schools that are looking to implement breakfast after the bell this year. If any schools still want to sign on, there is the registration link here, and we will gladly support schools this year. So we can still sign schools on. And that's the only update I have.
Thank you so much. All right. Next, we will come.
Yep. Hi, Sarah. I was gonna introduce myself as well to the
Oh,
group this morning.
so sorry,
Um,
Tara.
no worries. Hi everyone. I am Tara Westenheiser, Food Access Coordinator for the Division of Public Health, and I co-lead the Backbone team with Sarah, formerly Tiffany, and excited to have her join. And I just wanted to say hi. And I think next we have some coalition updates. And we'll start off with the SNAP Coalition and pass it over to Laura.
Sorry. We had a great meeting last time. Ray Burke from New Hampshire Legal Assistance came and did training on SNAP for college students, which was really informative and helpful. So maybe was 2 meetings ago. I'm sorry. So at this past meeting, we talked about the upcoming SNAP changes that came out of the reconciliation bill that was passed in July. Um, and we do lots of talking about SNAP in that group. And if you're interested, we meet on the third Wednesday at 10.
Thanks, Laura. And I believe next we have just a list of our monthly coalition meetings going on. Sarah, can you go to the next slide, please? Thank you. And this is just the different coalitions that are happening around the state, when they meet and what day and time. And
And
then I
watch
think, oh,
for
go ahead.
watch for different days around holidays and things like that. So these may not be fully accurate. So if you can be in touch with us if you have any questions about a specific coalition and its upcoming meetings.
And then moving right along, I think our next update is about New Hampshire Moves to End Hunger, and I'll pass it over to Jessica to share more about it.
Thanks, Sarah. Good morning, everyone. We are continuing on with our New Hampshire Moves to End Hunger. We have raised about $20,313, and total, we have moved as a whole group. There's about 60 participants, 2,614 miles so far. So we have a couple of people who have already met the 230-mile challenge and exceeded it with over 300 miles moved. Virtual miles moved up the state to end hunger. We are having a competition right now between all the different participants to see who can raise the most in 2 days, over $100. So I am going to put out the challenge to everybody here to make a donation to a participant they know or somebody who maybe hasn't reached their goal yet for their fundraising. And if the fundraiser or participant raises over $100 and is the top fundraiser in the next 2 days, they are going to win a $100 gift card. So we appreciate all your support, and we know now more than ever advocacy is needed and coordination around policy and systems change in order to end hunger in New Hampshire and keep these vital programs alive. So thank you all for your support.
Thanks for sharing, Jessica. And then now we usually spend this time to open up the floor to partners to share any updates they want to share with the rest of the coalition. You can come off mute or put the information in the chat. And so I'll pause for other updates. All right, seeing and hearing none, feel free to keep using the chat if you have anything you want to share out. Otherwise, I will pass it over to Sarah to introduce the policy updates.
Thank you so much, Tara, and thanks for coming in and introducing yourself. Now we're going to get in just a little touch. We're going to touch on this more throughout the presentation. Federal and nutrition, food security updates, and I will pass it over to, I think, Laura for this.
So there really haven't been any changes since our last meeting. The changes are still coming. The only change that has that people have been informed about and is actually underway is the change to the internet deduction. That will mean that people probably get a little bit less in their SNAP benefits. The other changes are supposed to be implemented as of November 1st, but we think that people will not experience the changes until their recertification. We have not been able to confirm that yet with the state, but we will keep a close eye on it. The other thing to know is, not as a result of of the reconciliation bill, but I think everybody knows that there's a shutdown in place, and USDA has informed states that there may be disruptions in benefits for November. If nothing is done, there will be disruptions. It's not clear if the USDA is going to take further action. They did in regards to WIC. WIC benefits will be ongoing, but SNAP is still a question mark. Please, watch our social media. We are speaking with the state as often as we can but they still haven't gotten guidance from the federal government. So stay tuned. I will also say that should benefits be disrupted, when the shutdown ends, people will get their benefits, but the month of November could be tricky for people.
So Laura, this is Susan Winnock from Community Action Program, Belknap Merrimack County's WIC Program Director. We've been informed that the WIC, they have enough funds for WIC to go through November 7th. So they do not know anything beyond that point. So I just wanted to clarify that.
Okay, thank you, Susan. I'm sorry.
Yeah, no problem. That just came out. So I want everyone to know about that.
That's all I've got.
Thank you, Laura. And just moving ahead, always we like to highlight that FRAC, the Food Research and Action Center, keeps a very robust pulse on what's happening in the federal government. This is just a snapshot of their advocacy page currently. So here is a great place to check in and participate in federal actions. And I will bring it back to Laura again so we can talk a little bit about our state policy strategy.
So I think people know that the reconciliation bill that passed in July shifts significant costs to the state. The first shift will happen in October of 2026. The state, instead of having to pay 50% of the administrative cost of running the SNAP program, will have to pay 75%, which we estimate will be at least an additional $5.75 million. And just to remind people that New Hampshire has a biennial budget, and this is not a budget year. So coming up with the additional dollars will be challenging. So all that is to say that we'll need all of you to be a part of this effort to help advocate to ensure that we can maintain the SNAP program in New Hampshire. And we'll be partnering with many of you on the call to work on this. The other thing to know is that we will be opposing, there are no less than 4 SNAP restriction bills. There may be 5, it's unclear what one of them is. And those are bills that limit what people can buy with their SNAP benefits. Right now, people can buy anything that's food. These bills are, I think, well-intentioned to make people healthier, to keep people from buying unhealthy food like soda. Some of them, I think, are target junk food. Unclear what that means. I've only seen the titles, not the bills. And some of them target sugar. It is our position that the SNAP program works because it gives people the dignity to buy the food that is right for them and their family. And also, we are very concerned that restrictions will restrict access because retailers will not want to have to police people. And will not want to spend the dollars to change their EBT systems. And so we really worry that people will not be able to run the program, which will restrict access, potentially not just for SNAP recipients, but for all of us. So we will be opposing those bills, and we hope that you will be able to help us do that. Thank you.
And here, just a reminder, looking back at the impact that we've had through your advocacy in 2025, it really makes a huge difference. And we hope that we can continue to build our momentum in advocacy in 2026 and make sure that we keep SNAP funded. Also, want to highlight, and Riona, if you want to say anything about the NHFAC policy and advocacy team, if anybody has not joined the policy and advocacy team, here's Riona's email. Do you have anything else to add on this, Riona?
No, but we're looking for liaisons between the coalitions, the food access coalitions across the state, who would like to learn more about what's happening during session. And if you are a well-connected individual in communities, we would love to have you join, because when we do need testimonies or individuals to show up, it is really fast-paced timeframes. So we would love to have the liaisons be that point person. And feel free to email me if you have more questions. Mike, I see you have your hand raised.
Yeah, I do. I wanted to go back to the piece about opposing the legislation which would restrict junk foods and sugary foods from the SNAP program. And to the extent that we are going to be advocating against that legislation. What sort of data is there to back up the assertion that SNAP works better when people don't have those restrictions? Because it feels to me like this is probably going to be a very difficult argument to make with a lot of people.
Yeah, so I mean, there isn't a ton of evidence to show that it doesn't work with restrictions. There is some evidence to show that it doesn't actually make people healthier. And there also is evidence that it is incredibly costly for retailers to implement these kinds of restrictions.
Oh, I
Um,
totally 100% buy that about the retailers. I worked for many years in retail, and changing over point of sale systems and it
I
is a
think
nightmare. That might be the best argument going, but the
Yes,
argument,
absolutely. That's probably where most of our advocacy will be, but it is, I think, important to note that that the SNAP program, gives people the choice to eat the way they want. Most people want to eat healthy. If we actually wanted to people to eat healthier, we would give them more dollars to be able to buy healthy food, which tends to be more expensive. So we'll be making all of those points, and we will put out talking points, and we will find all the research that's been done and get it to people to share.
Thank you. Thanks for bringing that up, Mike, and giving us an opportunity to get a little bit more into the talking points. And as we all get ready for this challenging session ahead. Any other questions and comments on policy and this area of our work this morning? As we warm up for Congressman Pappas to be here in a few minutes. Again, thank you for that. And any other questions? Anything we missed? Any other updates that folks have this morning from our work, from the field, from across the state?
Karen, there's some questions about AmeriCorps in the chat. Would you like to let us know what part of it is? There's a question if it is statewide.
Yep, it's statewide. We have about 50 volunteers throughout New Hampshire and 400 something people on our wait list waiting to get a volunteer. So there's a huge need for these services. Yeah, ask any other questions you may have. I actually have a question or maybe some advice from anyone who's connected with the Littleton area. I have a lady that I'm matching with a volunteer who she can't get out much. She doesn't drive and she needs like fresh food, particularly produce, and like healthier frozen meals to eat. Either like food delivered maybe from a food pantry, or she can go with a volunteer to pick it up. But she wants fresher food, and right now she only has mostly canned food and Meals on Wheels, which she doesn't really like.
Lindsay mentioned the North Country Health Consortium. There's also the
Oh.
North Country Family Services and North Country Food and Ag.
Oh, wow. Okay. Thank you. Let me write this down.
Yeah, it's a
Littleton
great place to
Pantry,
get.
Taproot. We're getting a lot. If you want to
Oh,
go through the
wow.
chat for your individual question, and we will send you these notes afterwards as well.
Oh, thank you so much. Appreciate it.
Awesome. All right, so we are actually moving very quickly ahead. So this is a preview of the presentation that we have. I'm actually going to stop share for now. The presentation is in a little while. And see, Victoria, has Congressman Pappas joined us yet?
No, not that I can tell.
Okay.
Nope, not yet.
So that being said, let's just open it up for any other announcements and questions. How would folks feel if we begin into our presentation for today, which is about data? We're a little on the early side, and we can pause that then when Congressman Pappas gets here. Sound all right?
I just quickly wanted to introduce myself real quick.
Welcome. Yes.
Michaela actually was the one that invited me here today. I'm with the New Hampshire campaign for a family-friendly economy. And we do a lot of work regarding SNAP, Medicaid, healthcare, property taxes, all of that. We're advocates for things of that nature, and fighting for things of that nature. And recently this summer, I was doing a lot of work. Oh, I didn't realize my camera wasn't on. Hello, everyone. Recently this summer, I was doing a lot of work with local small grocers and small grocery store owners, and interviewing store owners, just like seeing how the impacts of the defunding of SNAP would affect their community and as well as their business. And I have like little videos that I'd love to be able to just like connect with you, Sarah, or even Lauren, or even some of the folks that are like initiating this whole meeting right now. Just because I feel like it's very in parallel to some of what we're advocating for with keeping SNAP and fighting for SNAP and fighting for the funding of SNAP. So I just wanted to say hi. And my name is Tone. I'm a assistant canvas director with the Campaign for a Family-Friendly Economy, and as well as a field organizer. So,
well,
Tone, that would be great.
Yeah, welcome and so much. And yeah, go ahead, Laura. Like we were just talking about this internally yesterday about being able to connect with those constituents.
So I have like little videos that I've made already, and I have like a 9-minute video that I'll probably end up sending to you through email, or you can check out. But my plan is kind of actually clipping them down so I can make like almost social media clips, like for either Instagram, TikTok, Facebook. Because nowadays I feel like in my generation specifically, and even the younger crowd, everyone is consuming content in a different like aspect. Some people might consume it through radio, some people might consume it through news. But a lot of us are on our phone scrolling, and then we'll see the next news clip, you know? And I think that could be very beneficial to reach the younger crowd with this current issue, you know? But I would love to connect eventually for sure.
Absolutely. That's fantastic.
Thanks, Tone. I put my email in the chat.
There was a question if this is statewide, Tone, or is it regional based?
So for that work that I was doing, it was statewide. I was mainly working in Manchester though, specifically. I worked with like Uncle Bob's Market off of Kelly Street, Parkside Convenience off of Hooksett Road, as well as LeBon Cements off of Wilson Street. And I actually have videos, just interviewing them, like mic on and everything like that, just asking them questions that would really like break down like, hey, what's the percentage of your customers that are coming into this store that are using EBT? And then some people would tell me like 3 out of 5 people would come in and use EBT on a daily basis. Or some people would tell me, hey, I have a little bit of a lower customer base that uses EBT just because we're not as in that middle populated area, urban area. But at the same time, I was able to gather a lot of different like good LTEs from this, and be able to publish on Union Leader, as well as Concord Monitor. But it's mainly New Hampshire based. I can work anywhere in New Hampshire with this. It isn't what we're focusing on now currently, just because we're focusing more towards accountability work with our state representatives in our swing districts. But I'm more than happy to take some time and address these things as well as help anywhere I can. And I can definitely partner with my higher ups too as well, just to make sure that's cool.
Sounds like a really great alignment right there. And I think we'll probably be having some more conversations offline about that. Awesome.
And Sarah just slid in Representative Chris Pappas.
Wonderful. Good morning. Welcome, Congressman Pappas.
Hi, Sarah.
Hi. We are so glad that you are making some time with us this morning. And I will just turn it over to you. We're recording this for anyone who didn't get to make it this morning. So we look forward to hearing what you've got to share with us this morning.
Well, thank you for the opportunity to be with you. I hope everyone's doing okay. And just thought it was a good time to try to come by and get some feedback from you all and give you a sense of some of the things that we're really focused on right now. Of course, we're here together virtually while the government is shut down. You all know that. We all understand the implications of this. And there needs to be a political solution to get this taken care of. So we have not been in session in the House since mid-September. And I mean, I think that's incredibly unfortunate given the stakes of what a government shutdown means to programs that people depend on, to federal workers that aren't getting paid, people who are being furloughed. There needs to be a political solution here that includes a negotiation and an agreement on spending levels, on healthcare, and all the things that are at stake right now. It's hard to do that from my perspective if the House isn't even in session. So I hope that we will see some progress soon. Of course, we know there are important dates coming up for a number of important programs that serve granite staters from WIC to SNAP. And those are things that we're paying incredibly close attention to right now. Just backing up a little bit, it's been a challenging year, both on the appropriation side as well as just the government spending side to understand kind of the direction of things. I think you all recognize that the reconciliation bill that was passed over the course of the summer will do damage to programs that people depend on that are a lifeline here in New Hampshire, including cuts to the SNAP program, including cuts to Medicaid that will hurt some of the most vulnerable granite staters. Those are things that we work to hold the line on, and I'll continue to find ways to see if there's common ground with colleagues to try to roll back some of those moves that are going to put these programs out of reach to people who need the help right now. As we think about this shutdown, it's important to kind of know the state of play for some of the programs that are lifelines for addressing food insecurity in New Hampshire. Last week, it was reported that New Hampshire had about 15 days left of SNAP assistance that would be available. We're going to continue to work, number one, to bring this shutdown to a close, but number two, ensure that our state program is thinking about how to build resiliency so that those dollars can keep moving forward. 75,000 SNAP beneficiaries in New Hampshire could be at risk of losing benefits and would have to make some incredibly tough decisions about how to feed their families, and that would stress the network of incredible organizations that exist around New Hampshire that help fill in the gaps in terms of SNAP and provide the kind of food and nutrition that families need and deserve in our state. In addition, about 13,000 folks who are on WIC in New Hampshire will have benefits at least through November 7th. But at that point, things get uncertain depending on what the Department of Agriculture does with emergency funding. So that just all gets back to the initial point, which is there needs to be a negotiation to reopen government and fund these programs, which are just so crucial. Just let me thank you for what you all do. I think that too often hunger and nutrition get overlooked in New Hampshire. We're a state that does well by many metrics, but we know that far too many people experience food insecurity. And as families are dealing with an affordability crisis right now, whether that's rent, grocery bills, energy costs, all that puts so much stress on family budgets, meaning that we're going to need to figure out how to meet the needs of New Hampshire families. And so whether that's through policy at the state and federal level or just the work that organizations are doing on the front line to provide direct assistance, we want to support you any way that we can. and just really grateful for the resources that you put on the table for folks that help people navigate really tough economic situations. We've got to make sure that New Hampshire is a state where everyone can make it, regardless of your economic circumstances, that it's not just a state that's geared toward those who are doing well. But we really should understand that our moral test as a society is whether or not everyone is doing well, including those who are living on the margins. And so I think that's a high bar to clear, but that's an important obligation that we have to our neighbors and community members. And just really grateful for the work that you all do to help meet that need at this moment. I'd love to hear some of your feedback. I know Victoria from my team is on the call as well, and we'll make sure you all have our contact information. But we want to continue to listen and learn from you all. Happy to just get to see you and get better acquainted with the work that you're doing around the state of New Hampshire as we spend a lot of time on the ground, pounding the pavement across New Hampshire. But just appreciate the opportunity to come in and join your meeting here today. And please know how serious we're taking the government funding shutdown and the need to bring this to a resolution and have a negotiated settlement. That's the only way through. That's how every shutdown has ended previously. And political leaders from all corners need to understand that responsibility. So thanks, Sarah.
Thank you so much, Congressman Pappas. And we're really glad that you're taking this time. These updates are really helpful. It's really good to have an insight into what's going on in Washington, D.C., and a tough situation right now. And so, yeah, I want to give people a chance to raise your hand if you have questions. I know that some of my co-hosts here are watching the chat, if anything has come up in the chat for Congressman Pappas. How can we be helpful to you?
Well, as I said, we've got members of our team on. I'll also say Charlotte from our DC office, who handles things on the policy and legislative side, is also on the team on the Zoom too. And so just we'd love feedback, whether that's what you're seeing, trends, just observations from what's happening on the ground in New Hampshire, or recommendations for what we should really dig into on the policy side. What we always want to try to do is to try to support things that are really relevant and will help. And so we've gotten some really good feedback from organizations in New Hampshire about bills that are important priorities that would say help expand funding that New Hampshire organizations could capture, or just programmatic changes that would help make things more flexible for our state. So we're always all ears when it comes to that. What we don't want to be doing is to think we're doing something good in Washington, but then it just misses the mark in terms of what you all are looking for or the way it could be implemented here in our state.
Yeah.
Sarah.
Yes.
Joanne Burke, I have a question. Representative Pappas, thank you so much for coming. One of the things that we're really concerned about is this strategic stifling of national data that we all depend on. So on September 20th, USDA announces it's going to eliminate the hunger food security report that has gone on for 30 years, both bipartisan parties, and framed it in a very inappropriate and distorted way, saying it was bias and fear-mongering. We depend on this data to see how New Hampshire's doing, to see how programs work and how they don't work. Then, earlier, they took away the people looking at poverty and how to assess poverty rates. They've recently dismantled the CDC group that looked at hunger, nutrition, and nutrition status through a very comprehensive ongoing study called the NHANES study. We know they've taken down the EPA climate reports where diet and dietary practices affect climate change on lots of different parameters. So there is a targeted attack on accessing data and monitoring how we're doing. How are we going to argue New Hampshire's doing worse after these targeted attacks on SNAP and the rises in tariffs if we can't access the data? And it's not available. When we look at food pantry data, that gives us an indication, but those services are often anonymous, limited information. It doesn't have the depth and breadth and the distillation that the annual household security report. So what can you do? I mean, to me, that's a huge across the board initiative that we need Congress to say, this is not acceptable to cancel all this information that we need.
Joanne, thanks for raising that. And look, I've been hearing about this very directly from folks over the last few weeks, and I share these concerns. And I do think that this is part of an overall effort. I'm not a conspiracy theorist generally, but I do think there is an anti-science, just anti-data agenda that's at work to undermine some of the basic functions of government that help provide us with the visibility that we need to understand what's going on around our country. And if we can't really fully understand what's going on in our communities, then that also hamstrings our ability as a government to be able to respond to it. So that is something that's, I think, incredibly chilling. We're going to be working on that in our office in terms of how we respond and push back with our colleagues in Congress. I do think that, as we, kind of have hopefully a negotiation to end this shutdown. What we haven't seen throughout the course of the year is, efforts by the administration to abide by things that are negotiated on a bipartisan basis, programs that have longstanding bipartisan support that have been passed by Congress. You've seen a lot of funding freezes, a lot of moves being made by the administration that run counter to the prevailing agreements and laws that are in place. So I've got significant concern about that. We're seeing it not just at USDA, it's happening in agencies like Health and Human Services, the Department of Education, which is almost totally disbanded, their statistical analysis and data teams that help us understand what's going on in education around the country. So I think this is something that is just incredibly chilling to the ability of government to deliver for people. And we will do whatever we possibly can and have conversations with colleagues and also understand that has been over the course of the last year a role for the courts to play in upholding congressional spending programs, certain aspects of the federal government that are well established. And, certainly this is something that we just can't allow to slip away because it's really going to hurt us here in New Hampshire. I mean, we're a state where resources are finite. And that federal data is incredibly important to understand how we can use these precious dollars in the most effective way to get at the problems that we know exist in our society. So we just can't be moving forward blind because it's going to not allow us to be as effective as we can possibly be with the resources that we've got. So I appreciate you raising that. I'd love to stay in touch with what we can be doing on that front. And if there's an opportunity to sort of get some of your voices in that conversation, we'd love to think with you about how we can most effectively do that.
Thank you so much. I think that was wonderful framing for the conversation we have coming up after this on data. But before we move in that direction, I just want to see if anyone else has any other questions or shares for Representative Pappas. Not hearing any. Oh, did somebody come?
Sorry, it's just a continuation on the new SNAP error rate. Is there a way out of Representative Pappas and Goodlander to really frame that these many of these error rates are totally understandable because people applying for SNAP are often in part-time work positions, and the government's suggestion that if the error rate needs to be so low will really impact the state's ability to operate SNAP, and SNAP states can elect not to operate SNAP. And we know SNAP is an economic engine. So I think it's really important that people understand error rates are not based on someone trying to scam the system. It's usually just either someone was denied or someone was put on mostly due to simple human error. And the 5% error rate is again another way to dismantle being able for states to afford SNAP. So I think given this call for November, we should be really loud and clear of what this economic engine of $1.70 for every dollar that comes in for SNAP, how that will impact our state. So just hoping they can band together on getting the message out. Thanks.
Thanks again, Joanne. We'll be happy to work on that and appreciate you raising that issue, which obviously was included in the reconciliation legislation that was passed over the summer. I hope there's an opportunity for us to revisit that, but I think you make an important point, and we'd love to stay in touch with you on that too.
Yeah. Thank you so much. Again, thank you so much, Representative Pappas, for your time. You're welcome to stay on as we move into this next piece. And we so appreciate everything that you're doing to support food security in New Hampshire.
Okay. Thanks, guys. Take care.
Thank you.
Bye.
All right. I'm going to go back to sharing our presentation. And invite Tara. You'll be guiding us through this presentation today.
Yep. Thanks, everyone. So next up, we have our presentation for the day, Closing the Data Gap, How New Hampshire Measures Food Insecurity. And really, we're bringing together several partners from different sectors across the food system and gonna explore how we currently track food insecurity, what data we do have, where the gaps are, and how we can work together to improve the picture. And I will pass it over back to Sarah to get us kicked off with setting the stage for this presentation.
Sure. Thank you, Tara. So just a quick introduction of who's going to talk to us this morning about data. We're setting the landscape of the problem, and I think we just had a really great conversation already started about the landscape of the problem. Laura, Executive Director at New Hampshire Hunger Solutions, will talk about the federal nutrition programs and data landscape. And also Elsie Cipriani, Executive Director at New Hampshire Food Bank, will talk about the data that we are able to connect through the emergency food assistance programs. Next, we're going to have Gary Bledden, Coordinated Lead Entry Specialist at Granite United Way, talk to us about New Hampshire Care Connections and Unite Us. This is moving us toward potential solutions in the gap that may be developing here. And then to talk about the impact of food insecurity data, Chelsea Canavan, Manager in Population Health at Dartmouth Health, is going to talk about work that's been going on, screening for hunger in health systems. And finally, we'll wrap up with Phil Sletton, the research director at New Hampshire Fiscal Policy Institute, who's going to connect all of these threads together. The purpose this morning is that we need multiple data points to understand food insecurity in New Hampshire and ensure communities have resources to meet the need. I'll pass it to Laura.
Okay. So New Hampshire Hunger Solutions mission is basically to end hunger in our state. We are, and in order to end hunger, we need to know who's hungry. What are the programs that are out there that are helping to alleviate hunger, and are they working? So I'm just going to take you through a little bit of what we have had in the past and what we are facing in the future. Feel free to ask questions. Next slide, please. So I know this is word dense, and I shamelessly stole it from a recent webinar that the Food Research and Action Center and some partners did. You can see I've attributed at the bottom because I've changed the slides a little bit. But and as Joanne and the congressman talked about, the USDA announced in September that it was terminating the annual household food security report, which is also known as the Food Security Supplement, or FSS. So it was a comprehensive annual national and state level statistical survey on food insecurity. And it was sponsored by the USDA, but it was a supplement to the census current population survey. And you can see what the sample size is. It was nationwide, and it was typically conducted in December and released in September. I should say that they are going to, as far as I know, they are still going to release the 2024 data. I don't think it's happened yet. It usually happens in September. They said it would happen in October, so we're still waiting. But it will not be conducted going forward. And it was a really comprehensive survey. It was 10 questions for adults, and if they had children, there were an additional 8 questions. So there are lots of information on whether people are food insecure, and also questions to follow up about their food spending, food assistance, and food-related hardships. Next slide, please. And the particularly troubling was the language that came out with the announcement of ending the survey. The USDA said that it was repetitive and that it was partisan, neither of which is true. There really isn't another data source that is quite as comprehensive that's done annually. There are some other surveys that are done periodically or in particular populations, but this kind of across the board collecting of data annually so that we can look at trends, is not, there's no other source. So, and as I've said, policymakers and folks who are trying to alleviate hunger need this information to know who's hungry and what works. So, and the language in the statement from USDA is, just that it was fear mongering, which is like totally untrue. If you've ever looked at the data, it's not exactly like, juicy. It's like an incredibly dry read. Sort of demographic data about who's answered these questions and how. So, and it's long been the definitive benchmark for tracking food insecurity. And next slide, please. So again, just a little more information. It particularly tracked how SNAP, which is the first line of defense against hunger in our country, was doing. And so without the report, there's really no way to know. And this is at the same time that Congress has recently enacted all of these changes that will significantly weaken the SNAP program. So without these data, we will not know in a comprehensive way what the effect will be on people in New Hampshire and across the country. Next slide, please. And I just want to remind people that right here in the Granite State, we have policymakers who deny that there is hunger. Regularly, we testify in the legislature, and people say, well, but I mean, can you actually show us that there are kids who are hungry in school? Can you actually show that? Which, I mean, obviously the food insecurity report didn't help with that either, but I'm just pointing out that the fewer data that we have, the harder it is to make the case that about what's going on for people. Also, the responses are a way of making sure that we can target the amount of benefits and the kind of benefits that we're giving to people to the actual need. So that will be really hard to do going forward. And in fact, Congress has capped the amount that SNAP benefits can change in the next 10 years. So, which is also really concerning. So next slide, please. So I know that it really seems like it's all bad news, and it feels that way a lot. But and I've talked about most of these points, um, but they're not going to get rid of the historical data, so that's something. Um, and um, and that there was nothing wrong with the data quality that was made clear by the Office of Management Budget. So small happy news. Next slide, please. So I just wanted to give you a sense of what we at New Hampshire Hunger Solutions have been tracking. And we are focused pretty singularly on federal nutrition programs because those are really the first line of defense against hunger. Well, food pantries and food banks are incredibly important for meeting immediate need. The programs that lift people out of poverty, that help with long-term food insecurity, are federal nutrition programs. Next slide, please. So we were tracking the Census Pulse survey, which was started during the pandemic. That has been suspended as of September. So these are the data from September, which you can still see on our website, but they're not. The census is not running this survey any longer. Next slide, please. And I'm sure you've all seen the really wonderful data that comes from Feeding America on the Map the Meal Gap site. But unfortunately, that relies also on the food security supplement. And so I'm not sure what Feeding America will do. I'm sure they will explore innovative ways to collect data, but it's really concerning that we won't have this exact measure to use as a benchmark as we go forward. Next slide, please. So this is a slide. This is a screenshot from our website. We do track the SNAP gap in New Hampshire. We compare census poverty data. So the people who are under 200% of the federal poverty level, we compare that to the actual enrollment in SNAP to discover how many people are currently eligible but not enrolled in the program. And you can see this by county. Next slide, and that will continue. And we also track free and reduced price lunch enrollments by district. We know that there's under enrollment in free and reduced lunch. The estimates are by about over 10,000 kids, but it is important for sort of trend data to track these. And of course, we are working with schools to increase participation by eligible families. Next slide. And then we also track the number of children who participate in free and reduced lunch who are also participating in breakfast. And we know that there is pretty severe under participation in breakfast in New Hampshire, and that's why New Hampshire Hunger Solutions is working with schools to help them to implement systems that change the way we offer breakfast, because currently offering breakfast early in the morning makes it hard for kids to get there and means that it's typically thought of as poor kids' breakfast, which is incredibly stigmatizing, and kids won't participate in breakfast if that's what they think it is. So there are evidence-based ways to offer breakfast after the bell, and we're working with schools to make sure that happens. But you can see on our website, we track by school their actual participation rates. Next slide. Okay, so now I'll hand it back to Sarah because that's it for what New Hampshire Hunger Solutions is tracking currently. Sarah?
Apologies, getting to my little buttons here. So next up we have Elsie, and she will share data from the food bank.
Hi, everyone. My name is Elsie Cipriani. I'm the Executive Director for the New Hampshire Food Bank. This is an extremely interesting time for us, and I think for anyone in the anti-hunger field to be talking about data is always important, but especially now, because all the things that are happening at the federal level and also at the state level, I think food banks can play a vital role in terms of providing data for the system. And I'm going to be sharing with you guys a little bit of what we collect, but also the limitations that we have at this time, and how we can perhaps rely on others within this network and outside of this network to make a better sense of the food, of the data that we are currently collecting. Next slide. So I'm going to be talking a little bit about the data that we collect, how we get the data, what are our main sources, and what are the gaps, and what will be next for us. First, as Laura mentioned, as a food bank, we relied on the data that comes from Feeding America every year through the MAP, the meal gap. As we all know, this is great information. However, this is the caveat of this is that it's usually 2 years old. So the data that was published this year in the beginning of the year is usually around May, was from 2023. And every year is 2 years behind, but it's the best data that we can get at this point. However, that is going to be affected. So 2 weeks ago, I had the opportunity to be part of the Feeding America's Fall Forum. And this was one of the priority items that was discussed during this meeting, because Feeding America, to be able to produce the MAP, the meal gap, they relied on the USDA Food Insecurity Survey that Laura mentioned. So there is a lot of uncertainty, like many other areas, about what is next. Probably one of the highlights of this is that many food banks across the United States have been able to develop their own data systems, and they are collecting really specific data. Many of them don't even rely that much in map the meal gap from Feeding America, and they are doing their own thing. So I think that the challenge is now how we can all come together as a food banks and make sure that we take advantage of these systems that have been developed by others. And even though that is promising, and one of the goals from Feeding America is to become a leading source for food insecurity data because of what is going on with USDA, this is not something that is going to happen anytime soon. This is going to take time. And in the meantime, there is still going to be a huge gap for us to be able to make better sense of the data that we have at the local level. So what we are, besides the MAP, the meal gap, what are the data that we have available on a daily basis? As you all know, we collaborate and we work together with a network of partner agencies. Right now, we have 417 partner agencies across the state. And we get a lot of data through a system that is called Series. So this system allows us to collect distribution numbers, the number of people that our agencies are serving on a daily basis. So to give one example, if we run a report today, we are going to get the number of people that our agencies and number of households that agencies are serving or that they served last week. So it's usually the average of the average number of people that we serve through our partner agencies is around 100,000 people. And then if we think about households, that is around 30,000 households. So this is data that we can run and we can get on a daily basis. One of the challenges that we have, which was mentioned earlier by Joanne, is that there are not a lot of specifics on this data, right? Because we want to make sure that people that go to our programs or that go to any emergency food assistance program, they have a dignified experience. We try not to collect. Most programs try not to collect a lot of data. They don't ask questions. So there is no a lot of details that we get from the information that we have from our partner agencies, which is okay. We don't want to make the experience more difficult for people to access food. But at the same time, there is a good number of people that are not going to the food pantries because there is already a big stigma about going to food pantries to get food, especially now with all putting SNAP programs and some other programs in the center of the controversy that is just creating more stigma for people to go to food pantries and to access food assistance. And one of the things that we, as we move to look what else we can do besides the information that we are getting through our partner agencies, we also get information, not as much, but we also get good information when we run our own mobile food pantries. We get information about how many families we are serving, the different areas. We can see where do we have a higher demand for food when we run our own mobile food pantry. So that is also relevant information that we can use for resource allocation. But then when we look how we can make a better sense of this data, we definitely find some significant gaps, because even though we relied a lot on the map the meal gap from Feeding America, this information is given to us only by county. So we only have this information available by county. And also in terms of the different target populations, this information is by county, and it's also overall, and the only division that we got, the only group that we are able to get details is on children. So we don't have this data by gender or by different demographic groups. So that's a huge challenge that we have in terms, again, if we wanna be better in terms of allocating our resources, we need more specifics. So one of the things that we are doing is we are working with others within this scope to see how we can get access to more granular information that we can combine with the information that we are getting from our food pantries. So some of those socioeconomics indicators that we will be looking into in the future to combine with information that we already have is, for example, as Laura was mentioning, the federal programs enrollment data, poverty rate, income levels, access to affordable housing. If we are able to get more granular data around these specific socioeconomic indicators and combine that with the areas that we are serving and what our food pantries are doing, we can definitely get a better picture of how we can allocate our resources in the future. If we, for example, get some requests for partner agencies, for new partner agencies to become food pantries or to open a soup kitchen in an area where we know for sure that we already have a good network of agencies serving, we can reallocate those resources. We can reallocate that request to a different area. So that's what data is so important, is besides having the numbers, is it really help us with being more efficient and more effective with the resources that we have. Next slide. So this is just something that I wanted to share with you. This is the most updated number for our distribution levels for this year. So this graph that you see here is from January through September, the end of September of this year. So far we have distributed a total of more than 13 million pounds of food. And the distribution by county, you can see it there. As you can probably imagine, the highest numbers of distribution are concentrated in Hillsborough County, Merrimack. We do have distribution in other areas, and this is not directly related with data, but one of the things that I want to share is that the New Hampshire Food Bank has been conducted an assessment, a big, deep assessment this year, meeting with partner agencies, conducting listening sessions internally and externally. And one of the goals for us is to be able to continue decentralizing our distribution from Manchester to other areas. We started with the warehouse in the North Country, which we have had that for over a year now. And we have seen already very positive results from that. So our goal is to continue doing initiatives like that in other areas of the state. Next slide. So this is one of the best data points that we can get from the system that we currently have, series. So I wanted to show, for example, our distribution numbers 2024 to 2025. I didn't put the whole year for 2024 because I just want to compare the months that we have so far from 2025. So as you can see, for pretty much every single month, we have seen an increase in the number of pounds, that agencies are requesting from us. So if we see an average right now, we'll say that compared to 2024, we have seen an increase of close to 12% from agencies towards the amount of food that they are requesting from us. There are some specific months in which we see the request has been higher. It's okay. Next slide. Thank you. And another important data point that I was mentioning earlier is also our mobile food pantry distribution. And this is what is so important to have data, because one of the things that we are observing is that even though it's one of our most important programs, we understand, because of the data that we have, we are really good to understand now what are the areas in which our mobile food pantries are more effective. What are the areas in which have seen that the numbers have really decreased? This is something that was very, I would say, popular during COVID and was really needed. But since COVID, after COVID, we have seen that the numbers have decreased for our mobile food pantries, where the numbers in other areas are increasing. And again, because we have this, we are able to have this number and this data from the beginning of COVID, we are able to have a strategy and to reallocate these resources to other areas. So one of the things that we are trying to do with the mobile food pantries is that, well, we want to continue the regular mobile food pantries in the areas where we see the highest demand. At the same time, we want to revamp some of these mobile food pantries, because we know that many of our partner agencies are requesting more food. So how we can make sure that while we still have this great resource available, which is a mobile food pantry, but we are targeting different areas. We are trying to target different populations, and we are able right now to be able to do that because we have the data for the past 5 years. Next slide. I think that, yeah, that was my last one. So I will be happy to share more information in the future if people have ideas of how, based on the information that I share and the comments that I also had, if anyone has any idea of what other information, what other data will be helpful for you to see from the emergency food system, I'll be happy to work on that for future meetings.
Thank you so much, Elsie. And now we're moving toward more solutions and inviting Gary Blevin to share about New Hampshire Care Connections and the Unite Us platform. And I'll just say we may be running a little bit behind. This is being recorded. We hope everyone can stay to the end. We have a great summary coming up. But if you can't, we do have this recorded. So hopefully, Gary, I invite you to share now.
Perfect. Thank you. Good morning, everyone. I can't see me, but if you can see us, it's Gary and Brittany Bowles from the New Hampshire Care Connections team. I have shared our contact information in the chat. So for folks that are interested in some of the information that we talk about, we'd love to connect with you to share more about what the program looks like and how we might be able to tailor it to meet the individual needs of your agency. I do want to share that we are going to do our utmost to keep this brief, as Brittany and I do have a conflict. We're signing up another agency just across town, so I'm going to do my best to keep it short but concise. So as you see here on the slide, this is the New Hampshire Care Connections. I know you've all seen this before, but we want to highlight that, again, that it's free for providers. There are simple, secure referrals that are made. The network continues to grow through the outreach that Brittany and I are doing, as well as our partners at Unite Us. In addition to that, we have in the long term the potential to utilize this as a means for data tracking. However, what we want to focus on today, before we get into those long-term benefits, is what it's like to use the platform now. If you would please advance the slide. So what I wanted to focus on are food providers and what it could look like for an agency that is serving a community with food needs. So in my experience, in many cases, food access providers have some sort of enrollment or sign-up sheet so that they know who they're serving. In order to access the Unite Us platform and to create a client profile, you need most of the same information, and that's going to be the first name, the last name, and the date of birth. Once you've created that, you're going to be prompted with the face sheet, which does allow you the opportunity to create additional, or rather to provide additional demographic information regarding the client. However, understanding that if your community needs are great and your staffing is small, you have the opportunity to bypass those face sheet questions for the sake of ensuring that they're, one, counted, and two, that you can serve them and the rest of the community in a timely fashion. And so what you would do is enter your first name, last name, date of birth. Provided no duplicate exists, you'd skip down to the bottom of the face sheet. And then when prompted for consent, you could skip that as well, and that can be addressed at a future date. Now, once they are on the platform, you can, thank you. No, that's exactly it. Once they're on the platform, you now would have the option to create a case. And this is where you're going to count individual records for service for your clients. And so there are also a couple of ways that we can go about this. From that minimal face sheet and client creation, you are able to go to access their information, click on the cases link within their profile page, and then when prompted, you'll select your program, the date. The date enrolled usually defaults to today, so that there shouldn't be any data entry, the service type, and then your primary worker. And at the bottom, it's going to ask you for a description. You'll see here I very abbreviatedly entered food staples. And at that point, you click save, and now you have an active case for your client. Say that you can't get to the case now, they can go into a queue to be addressed at a later time, perhaps when you have admin or downtime based on your organization. And if you go to the next slide, this shows you what it's like to close a case. So within the Unite Us platform, I know that folks have seen it, may not be fully cognizant of it, but to the left side, there is a section called Internal Cases. You would open it, you'd identify the client or clients that you helped perhaps that previous day, click their name to open their case, and then start the process of closing their case, which involves clicking, and I'm sorry for the redundancy of the phrase close case. You'll click close case. You'll be prompted with this kind of screen that hovers above that looks for what was the resolution, what is it you did, and when did you close it. And so in this case, again, if you're doing your admin work in after the fact, you would adjust the day to the day that you provided the food. In this case, again, it's another abbreviated example of provided food because that's what you did. You don't need to get into the nitty-gritty of canned goods, frozen goods, poultry, etc. It is just, this is the need that was met. And at that point, once you close the case, it begins that process of tracking the amount of folks that you serve, which, as I shared, down the road will be the information that we're looking to leverage to kind of help continue to identify gaps in food insecurity. Now, I will say that unfortunately, I don't have slides for it because we're still in the process of mocking up what it would look like. But the third option is if you're unable to have the clients to register clients on your own, you could have an individual assistance request form QR link that is specifically tied to your agency. So for an example, if someone comes to your pantry and has a food need, you could give them the code to scan. They're going to enter their information, their first name, last name, date of birth. They're going to provide the additional demographic information. They're also going to go through the consent steps as it relates to participating on the platform. And then on the back end, so they'll do that on the front side. On the back end, you would come in, you would identify that case, you would assign it to the to food because that's primarily what your cases will be around, and then you go through the same process of closing it. So the goal is to continue to show different ways that the platform can be leveraged. It doesn't have to be a full, complete overhaul for your agency. It can be kind of tailored to, a mom and pop with, a small volunteer organization, all the way up to, I'll use Gather just because I live on the seacoast and I know that they have such a large scale and scope. So I say that again to say our contact information is in the chat. I would love the opportunity, as would Brittany, to speak to folks about how we could get you signed up. Again, the one last thing I want to stress is just because you're a participant doesn't mean that you have to buy the whole cow. So, for example, you can sign up just to use this as a resource guide. You can sign up to just receive referrals if you have the capacity for it. You could use the whole shebang and be a sender and receiver of referrals, or you can use the assistance request process that we just talked about. There are a lot of flexible ways, I think, that this platform can meet the needs of the residents of our state. And so I'll pause for just a minute. I did see that Sonia is here. She's one of our Unite Us liaisons. She may be traveling, but Sonia, if you're there, is there anything else you'd like to add about what we've talked about?
Hi, everyone. Hi, Gary. Hi, Brittany and team. Hi, Sarah. I am traveling, which is why I'm not on camera. Do not want to see this, what's happening. But I am really excited to be here. This is my first meeting, and I have learned a lot. It has been not all bad, so thank you for making it optimistic. I was just at the New Hampshire Hospital Association meeting, so got to meet a lot of wonderful people there and talk about the project. And Gary and Brittany have been wonderful in spreading the word. So yes, talk to them. They will tell you all the things about how to use the Unite Us platform and get involved in the project. There are so many different ways that you can. And like Gary said, you can use it day to day. You can use it once a month. You can use part of it. You can use all of it. And I think that it will hopefully fill some of these gaps that we're seeing in this now kind of massive gap that is coming. So would love to talk to you. Brittany and Gary can connect you with me and hope to see you on the next meeting.
Thank you
Thank
so
you.
much. No, go ahead.
I was going to say, I think that's my last slide, but if you could bump ahead just to make sure.
Just to make sure. Yes, and yep, it looks like
Oh, yep. Okay, perfect. That's my last slide. Okay.
moving
Well,
over, but yeah, go ahead.
I was going to say thank you again for your time. Brittany and I do have to scoot to go and meet with another agency to get them signed up. But again, we're sincere when we say it. You have access to our emails. Anytime you reach out, we'll be happy to get back in touch with you to talk through how we can make this work for your agency.
Thank you so much. Showing how the New Hampshire Care Connections and Unite Us platform can eventually add to our data landscape, but also very, very importantly, connecting people now to the resources that they need now. So the more participation from each of our organizations, thank you for saying, no matter the size, from the small volunteer run all the way up to a gather-sized organization, really helps connect people to those resources through this platform. So thank you so much.
Yeah, thank you all. Take care.
All right. And with that, inviting Chelsea Canavan from Dartmouth Health to talk about screening and referral systems that are going on through the healthcare system.
Sarah, I'm happy to share. I don't, I probably can't cover this in just a couple of minutes because I do have a lot of data. So just to throw it out there, I know it's getting late. So I did put my email in the chat. I feel like most people will have to drop off. If it would be more helpful to do this at a future meeting, I'm adjustable, but I'll continue if if that sounds good.
I mean, I think we can go over, and like I said, it's being recorded. So yeah, I hope people can stay with us this morning because I know sometimes it's hard to go back to the recordings, but yeah, I'd say let's give you your few minutes.
Okay, so I'm just going to share some of the data that we collect at Dartmouth Health. So I'm presenting some data from the health system. We screen all of our patients for food insecurity. This is showing the last 12 months of screening data where we screened almost 74,000 people. This data, so there's a few nuances to this, and I'll say a couple of things about the screening. So the questions are there. These are the hunger vital sign screening questions, which are validated, and there are two questions from there are two of the questions from the 18-item USDA screener that is that Laura presented that's being canceled. This screening for us is done electronically by the patient, either online before their visit in their online medical record chart or on a tablet at the time of their visit. So this is not a question that is being asked by a member of the care team. It's being presented electronically and answered individually by the patient. This data includes our member sites who currently use our electronic medical record system, which is Epic. So this includes DHMC and our community group practice sites in Concord, Manchester, and Nashua. It includes Alice Peck Day, New London Hospital and Newport Health Center, and Cheshire Medical Center. It does not currently include Valley Regional in Claremont or Mount Escutney or Southwest Vermont Medical Center. As those sites begin using our electronic medical record, we'll have more data to share across other sites. But I will say, like right here on the right, you can see 7.1% of our patients, which is just over 5,000 people screened positive for food insecurity. This is right on par with the USDA data that we see for the state of New Hampshire. So that is a little bit reassuring that it's not completely different than that. I think there's a strong opportunity here too. I'll just say, I know a lot of our other hospitals and health systems have begun screening as well to kind of look at how these rates compare across hospitals in different parts of the state, or even to combine them. Even with the USDA data, with this, 74,000 people is far more than have been screened via the USDA. But obviously it's representative only of our patients, and again, not even all of our patients. So a few caveats there. Can go to the next slide. So this shows a map of our food insecurity by zip code. And I'll just note off the bat, we don't really see significant differences in our data for New Hampshire versus Vermont for our patients. We do see a huge difference among our Medicaid patients who screen at a rate of 32.1%. And there's a map. The map on the right shows those Medicaid patients in some pockets. I'll note that the color and the percentages are slightly different between the two maps, but the percent of food insecure up to 50% in certain neighborhoods. And this only shows data for areas where we have enough data. So where there's really tiny numbers, those get suppressed and don't show up on this map, which is why there's more data on the left than on the right. But you can clearly start to see that there are pockets of greater food insecurity. And also, I just kind of wanted to share this map on the left to show we really do cover a broad geographic range across the state in terms of where people are coming from and who have been screened and represented in this data. Next slide. This shows the difference in food security rates, again, among adult primary care patients over the past 12 months by clinic location. So this is the division at each where they were screened. So this is not necessarily where they live, but based on kind of where they were screened here. Our highest rates for us in our data are in Manchester, our lowest rates in Lebanon, but kind of all falling between this 5.8 and 9.3%. And again, that overall rate of 7.1 that we see across our health system. Okay, I'll skip the rest of that. You can go to the next slide. This is my last slide. So with this data, we can start to look at some like demographic differences in the patients that we've screened. So you can really see here that we have some pretty major differences for patients who identify as Black or African American, Hispanic or Latino, and we've included this other or unknown. We do have a high number for people who do not identify their race or ethnicity in the data. So we do see some really big differences there. Our older adult patients, this tends to surprise people, screen at much lower rates. So all the way on the right, that orange bar shows people who are age 65 and older at 3.8%. Versus our other like adults between 18 and 64, a slightly higher rate of 8.4%. And that number is generally like a little bit higher for adults like in the 20 to 40-ish range. Again, probably people who have families and children at home would be my hypothesis there. Another like caveat to this is that there is double counting in this data, so someone might identify as multiple races or ethnicities. But for anyone who it did, identify as Hispanic or Latino, that rate is 17.2% compared to 6.8% among white patients and 4.7% among Asian. So we can really start to see some of these differences in the data across different populations in our state by geography, by age group, by race, ethnicity. And I think this data will continue, hopefully, to improve and expand as it becomes more standardized and we are able to include additional members of our health system in the data that we're collecting. So I will stop there.
That's wonderful. Thank you so much. Under a time crunch, giving this really robust data set that we really appreciate that we have. So I'm now going to invite Phil. Thank you so much for coming to tie together some of these threads.
Yeah, absolutely. I'll speak really quickly here too to help wrap up. But what we see, and I heard it in Laura's comments, and I want to echo those. Also, that I'm glad that Joanne raised them earlier. We see this loss of federal data that was really a really helpful measure of hardship, right? People can quibble about incomes and say, well, does a certain level of income mean you're facing hardship or not? When you're responding to a survey that you have a lack of access to food, or you didn't buy food because you couldn't afford it, or you skipped meals because you couldn't afford them, that is a very concrete measure of hardship. And that is a key part of what we're losing with the USDA survey ending. However, the positive side is because we have years of comparable data over time with that USDA survey and these other data sets, it means that we can still build a picture of food insecurity in the state and get a good sense as to how things may be trending over time. So an example of that, yes, we're losing the food insecurity survey, but Feeding America in their Map the Meal Gap county level estimates, they've looked at established relationships with unemployment, income, disability status. Those data will continue to be collected, right? We aren't losing all those data sets. We are losing the food insecurity data set in particular. There's already some relationships, some known historical quantitative relationships that we can build upon to understand what food insecurity looks like going forward. I saw from Elsie and from Chelsea and saw the framework of it from Gary, these data sets that are going to be helpful going forward. Because what we've done in the past is, especially when we're trying to compare across geographies, is use the data that we have available as just points of comparison. So the map that you can see here, for example, is a map that we have from the New Hampshire Fiscal Policy Institute. We were using SNAP enrollment to compare municipal level SNAP enrollments. And this is the percent of the population in each municipality that's enrolled in SNAP. The SNAP is not a perfect representation of food insecurity. People do or do not enroll in SNAP for a variety of reasons, both knowledge related and whatever stigma they may feel or other barriers they may face to enrolling in SNAP. That means it's not a perfect measure, but it does allow us to compare across communities what we know about the state of need and the state of food insecurity in those communities. We've done that to compare across geographies. Now, for food insecurity itself, we're going to need to use other data sets to compare across geographies and across time. And because we won't get new food insecurity data, we know some of these historical relationships between food insecurity and these other data. So establishing these new data sets, like what Chelsea was showing, establishing these new data sets that allow us to say, how close is this to how food insecurity was measured historically? Those data will allow us to then offer comparisons in the future. Elsie's presentation of how much food was distributed in 2024 versus 2025, it doesn't tell us as comprehensive a picture as the food insecurity survey, but it tells us something. And knowing those pieces of data, knowing those pieces of information from either data sets that already exist and are being newly harnessed for something, or data sets that don't exist yet, but we're establishing, right, that are being established in New Hampshire to try to measure and understand this. Those comparisons over time are going to become more important because we've lost the benchmark piece, but that doesn't mean we've lost all of these data, and that doesn't mean we can't build something that allows us to at least interpolate a picture of what food insecurity looks like in the state and how it's trending over time, which is often what people want to know when they're wondering about food insecurity. So that's all I had for my wrap-up thoughts, Sarah. I'm happy to hand it back to you.
Phil, thank you so much. And to each of the presenters this morning, it's really great to know that we're not left hanging without the data that we need to be able to address the needs that we have before us. It is a big gap that's going to be opening up, but once again, as is almost a recurring theme this year, we come in together at a more local level amongst our communities, and working together, we can get the work done that we need to do. So again, thank you everyone so much for your time this morning. We're gonna end it there, and we appreciate everybody's time. Any last words from the team? All right. Then thank you, and I wish you all a wonderful rest of the day.